there any reporters on?
Yes, ma'am, they are, and they're anxiously awaiting your presentation.
Okay, well, I'm finally on, so thank you very much. And I'll catch my breath because I was having a stroke. Good morning, and thank you all for getting on finally. Sorry for all that technical difficulties. All this high tech's great until it's not. My name is Barbara Devane, and I'm the secretary of the Florida Alliance for Retired Americans. Today is tax day, and I'm not usually that happy on tax day, but today I am, and this is why. Because we're here today to talk about not just taxes, but what's now happening in the White House and in Congress on fair taxes and how that relates to bringing down the price of our prescription drugs. Now, Jordan Cantor, our executive director of FLORA, and I have been involved in a campaign to lower prices of prescription drugs and now. And one of the reasons that I've been excited for almost 3 weeks now is because just before our brutal, disgusting, depressing, discouraging legislative session in Florida ended, President Biden delivered a speech to Congress. I've never in my life gotten so excited about a speech from Joe Biden as I did that night, all alone in front of my TV. I was glued to the TV. He talked about a lot of great things. And I really, really loved when he talked about fair taxes and how that relates to bringing down the price of drugs. Because in this country, we pay 3 times what anyone else in the world pays for the exact same drugs, prescription drugs. And finally, someone is not just talking about bringing down the prices through taxing the pharmaceutical companies who are hiding their profits overseas, and other individuals who aren't paying their fair share. But finally, somebody's not just talking about it, but they're doing something about it. And President Biden said to the Congress, we need to do this, and we need to do it now. The other thing is, people in Congress and other people, healthcare advocates like us, we've been talking for a long time about negotiations of drug prices in Medicare. And President Biden and members of the leadership in Congress are doing something about it. Already, they've filed the bill that we got passed in 2019, HR 3, that will not only give us the power to negotiate prices of drugs in Medicare, but extend it to private premiums as well. So, but that doesn't mean it's going to happen without a lot of action. And that's why we're here today, to talk about this and what we can do about it, besides just knowing that a bill has been filed, because it's a long way to getting it passed and signed into law. But I'm very optimistic about it, even though Big Pharma has they've already spent $93 million, the drug companies, giving money through their lobbyists, campaign checks, lobbying expenses, and now they're running an ad, their front group, it's running an ad in almost 50 congressional districts, maybe more by now. So today we have an expert that Jordan and I work very closely with. She's been involved with tax reform, as well as bringing down the prices of prescription drugs for many, many years. So I know she's excited too, because we have a Zoom call with her every Thursday at noon. And I can just tell everybody has such hope. We also have Representative Soto, who's very important in Congress on this bill, H.R. 3, because he's on the Energy and Commerce Committee, which will hear the bill. So let's get started with Margarita George, who is our national director of our campaign that we're involved in at Flora. Margarita, the floor is yours.
Hi, everybody. Thank you, Barbara. Can everybody hear me?
Yes.
Great. Well, thanks for having me on. It's this is a great way to kick off tax day for sure. And I'll just recap a couple of things that Barbara said. My name is Margarita George. I'm the executive director of a coalition called Healthcare for America Now, and I'm also the campaign director at Lower Drug Prices Now. And I want to, before I start, just thank Representative Soto and acknowledge the tremendous work that he and his colleagues are taking on in reintroducing H.R. 3, the Lower Drug Cost Act. And just to say that, you know, Lower Drug Prices Now, the Alliance for Retired Americans, many of the labor organizations, community groups, patient groups are all the way behind members of Congress on this fight to lower drug prices. As the president said in his speech, it is long overdue, and we know how to do it, right? We know that price negotiations will have tremendous benefits. I want to talk a little bit about how important it is to be in this fight around lowering drug prices, particularly with respect to tax day and the many different ways that the drug corporations benefit from the tax code. And of course, everybody's going to be paying their taxes. I hope to finish up mine and get them submitted by the deadline. But as much as everybody in America is sort of doing their part and paying their fair share, we know that prescription drug corporations mostly are not. They're not the only corporations. People probably have read that there's 55 Fortune 500 corporations in 2020 that aren't paying any taxes. And a lot of these are pretty profitable corporations. I'll just mention one because a lot of us had trouble with it this morning, and that is Zoom. Right, Zoom is a corporation that really more than doubled their profits over the last year and paid no taxes. The prescription drug corporations are particularly egregious in terms of their tax avoidance. They get tons of taxpayer money all the way through their business cycle. They get tons of money for research and development. We just saw that with the COVID vaccine, $12 billion to prescription drug corporations to develop that vaccine. We're making very good use of it, but you know, we should not feel like they're doing us many favors because companies are going to make tremendous profit off of that vaccine. Pfizer, just Pfizer, is going to make over 20 billion profits in revenue over the course of this year on the COVID vaccine. So they're benefiting from tremendous investment. You know, almost every single medicine that was approved by the FDA between 2010 and 2019 was created with taxpayer money. They're benefiting from all kinds of tax loopholes and tax breaks. So for instance, all the commercials that we watch on TV, if you like to watch late night TV like I do, the prescription drug corporations are getting a tax break for the $6 billion or so that they spend on direct advertising.
Jamie, thank you so much. In consumer news this morning, the Colonial Pipeline should be back to normal operation.
Hi, can people hear me?
Yes.
Okay. So I don't know if you heard that last bit, but obviously lots of tax breaks for this industry, for their marketing, their CEO pay. And then keep in mind that over the last few years, especially, the drug corporations have gotten huge tax breaks on their profits. And that's because of the Trump tax law that reduced corporate taxes from 35% down to 21%. So just as the corporations, and this, you know, the prescription drug industry is the most profitable industry in America. Just as those profits keep increasing, they are paying fewer and fewer taxes, while we that go to the pharmacy are paying more and more in terms of our drug prices. We know that we pay 3 times more for brand name drugs than what people in other countries are paying. So it doesn't, Barbara's right, it doesn't have to be this way. There are lots of different things that we can do, both in terms of the tax code and in terms of direct reform to these companies. And I'm gonna go ahead and wait for Representative Soto's comments on the direct reforms negotiations in HR 3. I'll just say that another way to make healthcare, including prescription drugs, more affordable in America today, in addition to, you know, making them negotiate and actually regulating them so that they don't have monopoly control over prices, is to make them pay their fair share of taxes, right? If they were paying their fair share of taxes, we could then reinvest that money in expanding healthcare to the uninsured. You have 900,000 uninsured people in your state. Texas has over 1 million. We could use the money from the fair taxes that these corporations pay to extend health coverage to those people and to actually help them afford coverage on the ACA exchanges or expand Medicaid, and do it so that people actually have the coverage that they need for their prescription drugs. Right now, people without insurance are actually paying more out of pocket than many people with insurance because there's no negotiations at all. So there is big opportunity this tax day. We're very excited to have the opportunity to work with members of Congress, allies like the Alliance for Retired Americans, in order to advance both prescription drug reform and tax reform that will finally create a fairer system, rebuild the economy so that it works for everybody, not just a wealthy few people and a couple corporations here or there, and ensure that everybody in America has access to affordable health care and prescription drugs. I'll pause there. Thank you so much for having me. It's great to be with you on Tax Day.
Thank you so much, Margarita. And it's always a pleasure to work with people like you who've been doing this for a long, long time, and who is so optimistic about what we can do now. Our next speaker, oh, you know what really gets me excited, Margarita, is the fact that when we save all this money in Medicare and through negotiations, possibly they could also use the savings to cover my eyes, ears, and teeth in Medicare. I've never been able to understand why they don't think that's part of my body. As an old person, we need that coverage now more than ever. But the next person that's going to speak is what we call in the ARA and in Florida, one of our heroes. Representative Darren Soto has 100% voting record for last session, as well as every session he's been in Congress. And we're so excited, not only that he's in Congress, but that he's on the Energy and Commerce Committee. And we know he's going to be standing tall for us on HR 3 when it hits its committee. So thank you so much for being with us. I want to call you Senator Soto because I remember you from those days in the Florida Capitol. And thank you for being our hero. And take the floor.
Well, Barbara, why don't you just call me Darren, since we've gotten to work together for so many years, and obviously longtime friends, all from Team Soto say hello. Thank you to you and to Flora for all the amazing work that you've been doing to help fight for Florida seniors. We stand with you. We know it's been a tough time. We passed the American Rescue Plan earlier this year to get shots in arms, money in pockets, and we prioritize seniors for vaccines and for the stimulus checks, knowing they're most vulnerable. I would be remiss if I didn't say get vaccinated. If you're listening to this right now and you haven't yet, it's time to get vaccinated and get our seniors freedom and prosperity back here and across the nation. Another key point in the American Rescue Plan before I go into HR 3 was the special financial assistance for multi-employer plans. We saw workers spend their whole lives paying into a system only to have their pensions put in jeopardy. And in the American Rescue Plan, we got it done. Upon approval of an application by a multi-employer pension plan, we grant them a lump sum that they could pay plans at benefit levels that they can pay back. Behind me is a picture of me and the Hispanic Caucus at the Oval Office just about 3 weeks ago. And can I tell you how thrilled I am about the strong leadership of President Biden? All I have to say is case in point, Exhibit A was 2020 and the chaos and issues that happened and so many Americans we lost and us wondering whether we could get it together in this country. And now steady leadership. I thought it was really relevant that someone's news just came on briefly and they talked about how the Colonial Pipeline's back on. This is the type of leadership we could expect to have again, which is thoughtful, competent leadership. And we saw that in the joint session, like you were mentioning, Barbara, that I had the pleasure of being in the room for. And it was one of the most straightforward, bold, matter-of-fact speeches I've ever heard, because it really laid out the vision of how we can make sure that we can have all those folks in the middle class, all those folks, Florida's working families, have a fair deal for taxes and be able to rebuild our country, to build back better with the American Jobs Plan. And part of that, I'm honored to serve on the Energy and Commerce Committee. We regulate most Fortune 500 companies and most of healthcare and the internet and energy and just about anything else that moves. And I was proud to co-sponsor and vote for H.R. 3, the Lower Drug Costs Now Act, when it passed last term. The Senate didn't pass it. We got to work on that this time. I feel confident about our ability to pass it again this year. And I want to thank so many Flora members who were in meetings with me throughout the time in the ramp up to that vote. We had a great meeting with Flora members at the Painters Hall in 2019. We had a couple of our town halls and Flora members spoke as panelists. So we're really appreciative of your membership for helping us to make the case. We already had our first hearing in the Health Subcommittee of the Energy and Commerce Committee for H.R. 3. I'm a co-sponsor again. The biggest thing it does is it gives Medicare the power to negotiate directly with the drug companies. This is what the VA health system and Medicaid already does. This is what normally those of us who believe in the free market urge to happen, to get the best prices for our seniors. And a lot of my colleagues across the aisle will say they're for Medicare being able to negotiate, but they find every reason to vote against this bill. They don't like this, they don't like that. Oh, but they're for Medicare negotiating. Well, it's time to put up or sit down. And this is finally to make Medicare have the chance to lower drug prices. It also allows for those lower drug prices to be available for Americans with private insurance. So it's much bigger. While negotiating for Medicare would already be a huge thing, the fact that it applies to all private insurance means that every American with private insurance can enjoy the lower drug prices. And it allows us to stop getting ripped off compared to other countries. We pay by far the most in the world. We have a lot of innovation here, and that's a good thing. But that doesn't mean we should have your average American and Medicare get ripped off by limiting the maximum price for a negotiated drug to the average prices in countries other than ours. Another key part is it creates a $2,000 out-of-pocket limit on prescription drug costs for Medicare beneficiaries. This is key. So many of my constituents, seniors who are drawing Social Security, maybe drawing a small pension, they run out of money by the end of the month. So they have to cut their medications in half, in quarters, waiting for that Social Security check to come in next month. This is very dangerous. This puts seniors at risk health-wise. I've talked to a lot of pharmacists and doctors about it. It is a travesty that seniors end up having too many out-of-pocket expenses. So that cap is going to be really important. And it also reinvests in innovation and cures for new cures and treatment. The other thing, there's a bill that Representative Dingell, also on the Energy and Commerce Committee, has that would use the savings in part for vision, hearing, and dental coverage. Like you had mentioned, Barbara, that this is absolutely critical. It's a huge gap in the coverage, even though seniors obviously have eyes, ears, and and teeth and need to be able to have affordable insurance for that. There's also other moves going around. The American Rescue Plan made a Medicaid expansion actually such a sweet deal that Florida would make money if they did it now, which was a shame why they chose not to, because not only do we cover 100% for the first 3 years followed by 90, but you get an expansion of 5% on the base program. That 5% on the base program is millions and millions of dollars, perhaps billions, and it would cover any expenses and then some that Florida would incur by the 10% match on the Medicaid expansion program. There's also been letters to potentially lower Medicare to 50 years of age that have come up, knowing that a lot of folks are, particularly from 50 to 64, still can't afford their health insurance. We're also working to make the telehealth rules permanent. I know so many seniors have appreciated being able to use telehealth for various types of health services that it may be appropriate. And lastly, you had mentioned about it, we are in the process right now of working on the American Jobs Plan, the major infrastructure package, as well as the appropriations package. When I think of the American Jobs Plan, it's all about boosting our roads, bridges, and ports, our electric systems to be more renewable, to make sure to have broadband across the United States, including in rural areas, as well as making sure that we're boosting our healthcare systems and affordable housing. This plan would be funded by a corporate tax adjustment. We know back in 2017, before the GOP did their GOP tax scam, the corporate tax rate was at 35%. That was already back in 2017. And we're not even suggesting to raise it back up to 35. But this plan would be paid for by going to 25 to potentially 28%. This will be a matter of negotiations between the Senate. But it's really still a cut compared to it was a few years ago, and still will make us competitive across the world. But it'll make sure we create millions of jobs, combat climate change, and build back better. And I couldn't be prouder to work alongside President Biden and the Democratic majority in Congress to get this done. And thank you, Flora, for having me today.
Thank you so much. Now you know why we love you, and we gave you our Hero Award. I'm sure you're going to get another one when we do our birthday parties for Social Security and Medicare and talk about prescription drug costs this summer. So thank you. And I know you have to catch a flight back to Washington to do your good work. So I really, really love working with you and your staff. Thank you so much.
Thanks,
and you
Barbara.
know, Margarita and Representative Soto talked about what a burden this is for our retirees as well as young people, because there are a lot of young people that have to be on prescription drugs and can't afford them as well. So we have two live older Floridians that are active in Florida, both retired educators, I believe, like me, and they have problems paying for their drugs, and they want to talk to us about it. You know, this really brings it home when you have these personal stories. This is what it's all about. So, Tom, are you ready? We can't hear you. Unmute yourself.
Good morning, everyone. How are you?
Oh, now we can hear you. Thank you.
Good. So I retired 5 years ago, had to pay my own insurance. Then I went to Medicare. Yay, Medicare! Yeah, not so much. So here I am, I'm a retiree, and I'm blessed in that at least I have a pension, and I do have my Social Security. But last year, in 2020, I put out $2,418 in my prescription drugs. They saved me $31,000. You know what? if I'm spending money, I'm not saving money. So that 2,418 is like one-tenth of everything, and that's just last year. So then this year, so this is all my drugs statements from last year. And then this year, just in the month of April, I entered the donut hole. And the month of April, I spent $1,311 on my prescription. $1,311. That's a little bit over a third of my pension.
Wow.
1,311. And meanwhile, the drug agencies are making money. So this is what happens when I have affordable health care. And when they say, listen, if my medicine really cost me $31,000, they're picking numbers out of their arse. Because there's no way in the world that anybody would be able to live that's on medication if they really had to pay. So they make up a number and then they say, oh, you're not paying the full cost, because they just make up a number. And we pay, and they always say, but we have to pay for research and development. As the good representative said, we the taxpayers pay for the research and development. We do. Now, you also mentioned another thing. In order to save money and help myself out, I'm supposed to take Trulicity once every 7 days. But I found that I can take it maybe once every 9 days. And that way I get a free almost 2 boxes in a year. Okay? But it's not the best for my blood sugar numbers. But you do it, why? Because this stuff is expensive. And then when I go to find out from the drug company, oh, maybe can I help get some help? No, I make too much money for help. Unless they can drain everything out of your pocket, the pharmaceutical companies aren't happy. If Walmart can go, because they're such a big seller, and I don't shop at Walmart, but they can negotiate prices from all their suppliers, the taxpayers, represented by our government, should be able to negotiate with the pharmaceutical industry the prices of our drugs. And that's my word. Thank you for listening.
Thank you so much, Tom. And this is why we are so engaged in this campaign to bring down the price of our prescription drugs. Is Janice on?
I'm here.
Hi, Janice.
Hi, how are you?
Storyteller. You have a story to tell. Tell it, Janice.
I certainly do. And I agree with everything that Tom just said, because I'm going through that as well. I am the president of FEA Retired. I retired almost 4 years ago. I have been a diabetic for 20 years, not on insulin for 20 years, but a diabetic for 20 years. But I am on insulin now. Part of this is my problem because I don't understand what the donut hole means. I have no clue what that means. I have been able to purchase 9 vials of insulin for $20. And the next time I get the insulin, it's $863. I refuse to even pay that. So my husband is from France, so we took a trip to France one summer. We've been many times, but one of my cousins is a pharmacist. He could not believe what was going on. He said, "You're paying for this?" I have to. Well, I came back from France with as much insulin as I could carry. Didn't pay a dime. But here, the price keeps changing. All of my medications, I'm on some oral meds as well, and they keep changing because of a donut hole, whatever that is. So I have Trulicity. I have not used it yet, but my doctor gave me that. I realize they're just making money off of us. I understand that. But what if you don't have the money and you need the prescriptions, what are you supposed to do? Because I'm getting supplies from Medtronic for my insulin pump that I use. That is the biggest rip-off company that I have ever heard of. My insurance, which is SilverScript, they don't want you to ask them questions. I have asked them over and over and over, what is this donut hole? What did I get? The young lady I was speaking to hung the phone up. So I still don't know what the donut hole is. I'm almost afraid now to call in my next prescription that's due, because one month is $33. Another month is $67. I do have Blink Health. I use Blink Health sometimes when it's cheaper than my insurance. But here lately, Blink Health is out of control. I have not tried Good RX yet, but people talk about it and say it's really good. Tom says, I don't know what else to do. This is the insurance I have because I'm retired, and everybody is screwing older people to the wall. And there's nothing we can do about it. I was in the store one day. This is when I was still working. I was in Walgreens, and an elderly couple was in front of me getting their prescription. And when the cashier came back, it was too much for the husband. He said, well, I'll pay for hers because I can't pay for both of them. Well, that killed me. I just ripped out my card. I said, here, pay for his medication. And the cashier said, well, ma'am, I can't do that. Excuse me, you can't do that? Pay for his prescription. So she didn't say anything else. She took my card. He begged me for my name, my phone number, my address, so he could repay my money. I wouldn't give him any information. I couldn't stand there knowing that I could pay for it and let that man go without his medication because he didn't have enough money to pay for both of them. And the people at the drugstore, they don't seem to care. Isn't there something they can do to help people when they come in and they don't have enough money to pay for all of their medication? I don't understand. I'm not understanding. So I'm in the same boat with Tom. I don't know what I'm supposed to do. I have to take the insulin. So I will take the insulin. But when I have to get more insulin and they tell me, oh, you know, that's how much it costs. I said, it doesn't even cost that much to make it. And you want to charge me $863 for something I have to keep me on this planet, knowing full well that I don't have that, just dole out $863. Well, ma'am, that's how it is. That's how it always has been. So one of my endocrinologists, the best one in Palm Beach County, she died several years ago. She had leukemia. Her name was Dr. Osa Nyman. She was the one who told me, get your medication from Canada. Well, if you try to get your medication from Canada, you can't, because the United States will block it and tell you you can't get it from Canada because it's available in the United States. And if it finally does get through, it's a delay, 2 or 3 months. You're waiting for something that you need next month, and they're still holding on to it. So Canada is out. I have a sign-in information with a pharmacist in Canada, but it's not doing me any good because I can't get the medication because the United States won't let it in. So they're not trying to help us one bit.
So we have to help ourselves, Janice. Well, thank you so much,
Thank you.
Tom, for coming on and telling your stories.
Barbara,
And you know, there are millions more just like you out there. We got to
Barbara,
wrap this up now.
I know,
but
but Barbara,
I would like to say
no,
there is something that we can do about this.
no.
And I am very optimistic that we can get it done because HR 3 has been filed. You heard Representative Soto. They've already had one hearing in his committee on it. And so we're either going to get it through HR 3 or through it being inserted into the American Families Act that President Biden talked about. And the reason I feel really optimistic about us getting it this time is because people who think like us are in charge now. And the people really, really want it. And the people are letting, hopefully, their representatives and their US senators know how bad they want it. The latest poll says that 90% of the Democrats polled want lower prices on our prescription drugs. 80% of the Republicans polled want it. So it's up to us to back up our representatives like Soto and many others that we have in Congress from Florida. And it's time for us to let them know that we appreciate what they're doing for us, that we know they voted for the bill before and they're going to do it again. And then we turn our energy to the Republicans from Congress in the US House from Florida. And then we turn our attention to Senator Scott and Senator Rubio. We got to get their attention by sending them messages through email, phone, going to see them and their staff, etc. And we in Florida are doing exactly that. Jordan and I Zoom, you know, with our local ARA chapters in Florida every week, sometimes twice a day. And we're reaching out to others. There are many, many other organizations in this country that have signed on to a letter that was sent last week to every member of Congress. Even the AARP has come around this time. They didn't last time when we had the bill up several years ago. But they're on the letter. They're the first ones on the letter because they're the first in the alphabet, along with many other labor organizations, our ARA, Alliance for Retired Americans, many healthcare advocate groups, and many consumer groups, because this is a consumer problem. But the people, we have the power to be the solution. So I thank you all for being on today, the media, our storytellers, our experts, our member of Congress. And if anyone in the press, in the media has a question for anyone, you can put it in the chat. If they've gone already, because I know Margarita had another meeting and Representative Soto had to catch his plane back to Washington. So thank you all for coming. And Jordan has her email in the chat. And I would like to let you know that all the media is going to get a press release today in just a few minutes, if you haven't gotten it already, that lays out the whole problem and the solution with lots and lots of numbers. You heard some of the numbers today, but there are lots of numbers about the profits of big drug companies and the problem that it causes with the price of prescription drugs. So thank you all, and we'll sign off for now.